Welcome to Cochrane Complementary Medicine's Evidence for Everyone series. Today we'll be explaining randomized controlled trials. When making decisions about treatment, it's important to understand the likely benefits or harms of using a particular treatment compared to other treatments or to no treatment at all. But what's the best way to find out whether a treatment is likely to work? One way is to compare health outcomes in people who do or don't use the treatment you're considering. The problem with this is that the people who use a treatment are often different from people who don't use a treatment. These differences may be related to their health outcomes, and it's hard to know what the effect of the treatment itself was. Here's an example of how this can be a problem. If doctors give one group of very sick people a promising new treatment for a month, and they give a standard treatment to a group of people who aren't as sick, are any health differences between the two groups at the end of the month due to the different treatments? The answer is that we can't tell because the groups are so different from the beginning. For a fair comparison, when a treatment is tested, the people who do or don't use the treatment should be similar in every way, except for the treatment. However, while some differences between people might be easy to see, others might be unknown. Because we aren't able to understand all the ways that the comparison groups might be different and control for this, we use chance to create similar groups. This is why randomized controlled trials are considered the best way to make a fair and objective comparison between two or more treatments. So, how does a randomized controlled trial work? People are assigned to treatment groups by chance through a process called randomization. Randomization can be done by tossing a coin or a dice, or using a paper table or a computer program. It is randomization that helps to create similar comparison groups. Once the participants have been randomly assigned to their groups and are given the different treatments, they are followed for a predetermined period. At the end of this period, researchers measure health outcomes of all participants and compare the results. Because of randomization, any observed differences between the groups should be due to different treatments. While randomization is important for a fair comparison, it is just the beginning. Some additional things can help keep the comparison fair and objective in a randomized trial. We'll highlight two of these things: blinding and loss to follow-up. So, what is blinding? Blinding, also sometimes called masking, is when people are prevented from knowing who is getting the test or the controlled treatment. All of the different people involved in the trial, including the participants, doctors, researchers, and others, can often be blinded to treatment. When blinding is used and people don't know who is getting the treatment, this keeps people from changing their behavior in ways that could spoil the fair comparison. One method for blinding that you may have heard of is placebo. Placebo is a fake treatment. It appears to be the same as a real treatment, but does not have any active ingredients. Using a placebo or other method of blinding can be especially important when information is collected on results at the end of a trial. This is because knowing what treatment a study participant is receiving can influence judgments about the results. For example, if the researcher collecting information at the end of the study knows that a participant is receiving a promising new treatment, the researcher may be unconsciously biased toward thinking that the participant had a good outcome. The second important thing to think about is loss to follow-up. When people have missing information at the end of the trial, this is called loss to follow-up, and there are several ways in which it can spoil a fair comparison. One way is that the missing information may be related to health outcomes and thus give a wrong picture of the study results. For example, when people receiving a test treatment who don't feel better drop out of the study and are lost to follow-up, but people who do feel better on the test treatment stay in the study and provide their results, this makes it look like everyone in the test treatment group got better, which is not actually true. In general, when there is a lot of loss to follow-up, it is difficult to tell whether the study results reflect the truth. The more missing information, the more uncertainty. This is why it is very important to minimize loss to follow-up in a randomized controlled trial. In summary, the best way to find out if a treatment works is to use a randomized controlled trial to test the treatment. First, use randomization to create comparison groups. Then, treat the comparison groups the same during the trial and use blinding if possible. And finally, collect results from everyone at the end of the study. Here are some key points to remember. First, a randomized controlled trial is a test of treatment using chance to decide who does or does not use the test treatment. We use it because randomization creates comparison groups that are similar on average. The randomized trial is a fair test of a treatment. If a randomized trial is conducted properly, you can be pretty confident that the differences between people who do and don't use the treatment are due to the effects of the treatment itself. Thank you for watching this Evidence for Everyone video from Cochrane Complementary Medicine. You can find more videos like this one as well as other informational resources at the links provided here.